How many of you are familiar with Ayurveda? Not a very many hands, one or two, yes, okay. So the term, how can Ayurveda help you? It's a little tongue twister for many people. And basically, it's a traditional East Indian medicine. So today in the talk, what I would like to do is I want to cover some of these points as to what is Ayurveda, very briefly give an overview about that. What are the aims of Ayurveda? How these aims can be achieved? What are the common conditions that we can use Ayurveda to be giving us more help and wellness? And what can you expect when you come to see an Ayurvedic practitioner? If you have any burning question as I'm talking, feel free to stop me and ask the question. Otherwise, try to hold your questions at the end of the session. I'll have plenty of time for question and answer session, because I would like this to be more of an information exchange, an interactive discussion rather than just a one-way flow. But to prepare for that, I do want to give you a little bit of background about Ayurveda and what it can do for you. Okay? So Ayurveda is basically a traditional East Indian medicine. Those of you who are already using the Bastyr Center for Natural Health are familiar with the traditional Chinese medicine, the acupuncture and the Chinese herbs, etc. So Ayurveda is the traditional East Indian medicine. Quite often they have the same common roots, as we call it, because they all kind of evolved in the same part of the world geographically, so to say, around the same time. And in earlier days, when the Ayurveda was it's supposed to be more than 2,500, 3,000 years old medicine. And there was quite a bit of interexchange between the Chinese and the Indian scholars, if I may say so. So that's why there's some similarity as well between the two medicines, but there are quite a few uniqueness to each one as well. So Ayurveda is not just the medical science, but it is arts and science of life. One of my colleagues, one time when he was talking about, he mentioned that anything and everything or any question that has ever occurred to a human being has been asked, has been dealt with in Ayurveda. Because Ayurveda also deals about what is life, what is the purpose of life, how did the life come about, and how can we live this life in a full, healthy, fulfilled way so we can achieve our purpose, our goals in our life. So it's about the science of life, not just I'm ill and fix me. It's also a holistic, integrative approach, not just for our body, but body, mind, and spirit. In this physical realm, in more so-called Western modern scientific world that we live, we pay more attention to just the body. Now we have started paying a little more attention to our mind. But very few of us pay attention to the third entity, what we call spirit. According to Ayurveda, the life is a conjugation of these three principles: the body, mind, and spirit. Whatever you want to call that spirit, whatever name you want to give, whether you call it soul, my inner self, my higher self, my God, whatever. But unless and until that third entity is present, the life does not exist. Once that entity leaves this body, the body becomes dead. The body is still there, and it will gradually disintegrate and mix into the components where it arose from, so to say. So according to Ayurveda, it's really the life is body, mind, and spirit, a conjugation of all the three. So when we talk about using the Ayurveda to help us, we always talk about not just how it's going to affect physically, how it's going to affect us mentally or psychologically, but how we can also bring in the third component so that we can enjoy proper health. It is one of the longest continuously practiced field of medicine. In India, even currently, Ayurveda is, in many areas, a mainstream medicine. It's not an alternative medicine, or it's not a complementary medicine. Granted that more and more people are attracted to Western medicine since India was colonized and influence of the British Western in philosophy, and they wanted to bring in their medicine, etc., etc. And so Ayurveda did take a little bit of a back seat, and there is now a revival, but it has been continuously practiced field of medicine for more than 2,500 to 3,000 years. So that's the root and background of the Ayurveda. Okay. So what are the aims of Ayurveda? The first and foremost, maintain the health of healthy people. How many of us feel that we are healthy? Good. Well, I'll ask you the same question again in a little while when we talk about what is health. But that's the main purpose, to maintain the health of the healthy people and prevent any disease formation. The second goal of Ayurveda is to cure and remove illness and disease of ill people. Now, when we talk about the cure, you have a headache, you take the pain pill, your headache goes away. You're cured of your headache, but you're not yet cured of your illness. So when we talk about the cure in the Ayurvedic understanding, we're not just trying to do the symptomatic treatment, but we're more interested in trying to find out, why did you have a headache? What were the underlying factors? And what can we do to remove the underlying factors so that we can cure the underlying cause that is producing the symptoms or causing the illness? So the aim is to cure and remove illness and disease of ill people. Once that has been done, then the Ayurveda wants to restore the balance and health. Because if we do not restore the balance and health, we're going to go back into the same mode again. We're still going to have the same symptoms, same problems. To promote the longevity and healthy aging. Now that is, bless you, such an important topic of this age, because all the time we keep on hearing how the overall our America is aging, and more people are moving into that so-called senior group, including myself. And so my definition of senior and old age is changing as time goes by. But the idea is to promote the longevity and healthy aging. So not just aging, but the healthy aging. And along with all this, to improve the overall quality of life. Even if I'm healthy, even if I'm secure, but if my interpersonal relationship with my friends, my family, my society, my environment, my nature is not healthy, then I'm having a poor quality of life. So the Ayurveda really integrates not just the individual, not just the body and the mind, or the body, mind, and spirit, but also the society and the environment. So it kind of tells us how we can live in harmony with nature. Because we are not isolated. We are connected intimately with not only each other, but also with our environment. So, going back to the aims of Ayurveda, health maintenance and disease prevention. That's the first aim that we talked about. So, what is the definition of health according to Ayurveda? Health is not just absence of disease. So because I have not been given a label that you've got high blood pressure, you've got diabetes, you've got IBS, or whatever you name, it does not mean that I'm healthy. According to Ayurveda, balance is health, imbalance is ill health. And even when we talk about the disease, first, there's a slight imbalance that causes dis-ease. And if that imbalance is not controlled, not treated, not using the healthy diet and the lifestyle brought back into balanced state, then over a period of time, we become diseased, have the disease. So having that, so what is the balance? When we talk about balance is health, what balance are we talking about? So these are some of the terms that we always use, but don't worry about it. Some of you might have heard the term dosha, but dosha is basically energetic principles that govern our body's function. Our body's functions are governed physiological, psychological, and even the anatomical development are governed by the doshas. So balance of these energetic factors the balanced digestive fire and the metabolic fire. So if you are really healthy, your digestion is very good. Whatever you eat, you can digest. You don't have heartburn, you don't have indigestion, you don't have bloating, gas, etc., etc. Your bowel movements are normal practically every day. But if that's not the case, obviously you're not healthy. It also talks about proper formation of the tissues, the bodily tissues. Our bones are formed appropriately. There's a balance between the bone forming and bone resorbing cells so that we don't go into the phase of what we call osteoporosis. Many of us go to gym, try to buff us up. And yes, if you look at some of these people, when they have lots of muscular development, to a point they look healthy. But once they go beyond that point, they start looking, to me, grotesque. And if you look at their overall physiological functions, they become stiff. They lose that limberness, that flexibility. So even though you said that, look at me, I'm so healthy, I've got buff, but they're not healthy yet because they're not in the balance. Their anatomical proportion, the tissues are not in the balance state. Cellular metabolism waste has to be produced in an adequate amount and needs to be removed appropriately, efficiently by keeping all the channels open. So if you're sweating just right, your large bowel amounts and the urine amounts in proper quantity, you're okay. But if you have excessive of those or in excessive of those, you're not in balance. The proper functioning of the senses. We have 5 senses. And how these provide us the satisfaction. And if we are overusing or underusing any of these senses by choice, or even sometimes not by choice. For example, if you're walking along and you keep on being bombarded with the loud noises of the construction going on around you, or somebody in the car having loud stereo going that you actually feel that vibration. So at that time, our sensory organs, our senses are thrown out of balance. And it does have some repercussions on our health, depending on how long it lasts. The clarity of the mind. So if we are really healthy, we have clarity of the mind. We can make the right choices. And overall, it is the pleasant, happy, blissful state of oneself. That's where we talk about how is our spirit today? When I get up, how do I feel? Not just being tired or energetic, but do I feel that everything is just right with the world? That is my blissful, happy state. Do I feel that I'm in the right moment, with my right surroundings, with my pleasant, loving family members or friends, that I can look forward to charging the rest of the day in a very energetic, positive outlook, positive attitude. So, to have a health, this is what we call balance. Now, thinking about this, how many of us think that we are in balanced state? Good, very good. So congratulations to all of you. So that's what the health is. So again, as I said, so aim of the hour is to help maintain the health and prevent disease. And so how do we do that? Because if we follow the appropriate diet and the lifestyle, because it is after all the science of how to live life. If we do that, we allow our body's innate intelligence to repair itself, to restore itself. So if I'm aware as to what's going on when I eat hot, spicy food, go to a Mexican restaurant, have a shot of tequila, and then have that chili sauce with enchilada or whatever. And if I get heartburn, I know that that was not right for me. So if I don't pay attention to that, if I don't change my diet, if I don't change my lifestyle, I'm going to start getting this problem, so-called hyperacidity, heartburn, moving on to GERD, as we call it, GERD, moving on to peptic ulcer disease, all kinds of stuff. So we can maintain the health by adjusting our diet, adjusting our lifestyle. If I just be a couch potato, I may feel fine for a while, but overall, after some time, it will start slowing down my metabolism. It will start allowing me to put on some more fat. My digestion will start suffering. So if we do exercise, the right amount of exercise, then I can stay and maintain that healthy balance. But again, the importance is right amount of the exercise. If you go beyond that, then it starts causing problem as well. How many of you have seen joggers who are really jogging with, they've got the braces on their knees, and the racquetball players having the braces on their elbow or the wrist, because they're overutilizing their body and they're causing the destruction and degeneration. So having the right type of lifestyle and the right type of diet can keep us healthy. And if we be mindful about that. So it helps to cure and remove illness and disease of illness of ill people by individualized, customized management protocol that includes natural methods like herbal supplements, body therapies like massage and some other specialized treatment, cleansing and purification methods. So yes, diet and lifestyle keeps us healthy and would move us in that direction. But when we have some issues, some disease, some problems, we do need some more additional treatments. But these treatments are not generalized because according to Ayurveda, each person has a unique individual constitution. No two people are alike. Even if identical twins may appear alike, think alike more often than not, but they're still not alike. Whenever I talk about this, I'm always reminded about this two friends of mine who were identical twins. When I met them first time, I could not tell them apart except looking into who is the spouse with that person. And then I can say, oh, this is so-and-so, this is so-and-so. But interestingly enough, they both were doing postdoc fellowship in Department of Physics. One was in a little different field of physics than the other. They both were driving a VW Bug of the same color. They both were into racket sports, so that's how I knew them. I was playing racquetball with them. So in many ways, they were functioning, thinking, acting alike. But after a while, I could tell the difference that, oh, this is so-and-so, this is so-and-so, even though they looked very much alike, because I was able to then find out there are a little bit of nuances as to how they think, how they act, how they behave. But the most funny thing was that they both, when they finished their studies, decided to move to USA without telling each other. Not only that, they decided to move on the same day. So one person comes with one wife and a kid. The immigration officer waves him through the border. 2 hours later, the other guy comes. And of course, the immigration officer says, I can't let you go through. You just went there. Now you're bringing another person, another kid with you. You're doing smuggling the human beings in the country. I can't let you do that. So that's the funny part, that even though they look alike, yeah, but they're not still always alike. So according to Ayurveda, no two people are alike, exactly alike. And that's why all the treatments that we come up with is individualized, customized treatment protocol. Suppose, say for example, if somebody comes to me with high blood pressure, for one person I may recommend something, but for the other person, based on that person's constitution, I would recommend totally different thing. Whereas here, if you go to a doctor, they would first give you one pill. If that doesn't work, then says, okay, now let's try this other one. If that doesn't work, let's try this one. So, but we don't have in the Western medicine that concept as to how come that one pill doesn't work for everybody. Because it's not supposed to. So that's why we need to find out who it's going to work for, and then give that pill to that appropriate person. And that's where is the beauty of Ayurveda. Ayurveda understands the uniqueness of each person, and that's why the treatment protocol is customized. It helps to restore balance and health. So once we take care of the abnormal situation, we try to restore the balance. Again, as I said, at all the three levels, the body, mind, and spirit. Not just by diet, not just by lifestyle, but also, along with the herbs, include some other practices like yoga, pranayama, which is the breath practices, meditation practices. So now we can nourish our spirit, our soul as well, along with our mind and the body. And it promotes the longevity and healthy aging by using rejuvenative therapies, including the periodic cleansing and detox, and appropriate revitalizing herbs, and then appropriate diet and the lifestyle that would go along with it. Only recently, even in the Western world, now we have a specialty called geriatrics. 3,000 years ago, in the Ayurvedic literature, they have given the different aspects or different fields or different branches of Ayurveda, as we call it. One of that was geriatrics, and the second one was revitalizing. So nowadays, if you turn the TV on, hardly an hour goes by without you hear the commercial about either ED, your T level. Ayurveda recognized that even though we age, we need to maintain our health, we want to maintain our potency, vitality, vigor. So they've talked about that even then. And so when we talk about the healthy aging, we try to talk about what all we can do. And it is never too late to using Ayurveda for this type of help, but it is better if you start earlier in your life, because what you do earlier does affect you later. So we can revitalize and go with healthy aging using the Ayurvedic approach. It helps to improve the quality of life. So as I said, by understanding one's own constitution, and this to me, when you understand Ayurveda, is a key point. When you know your own constitution, when you know your own energetic dosha mix, as I call it, then you know a lot more about you. So this is about exploring and knowing yourself. Who am I? Why am I suffering from this? Why am I acting in this fashion in such circumstances? For example, when you're going in the traffic, a bad commute, stop and go traffic. And if you look around, some people are angry and frustrated. Some people doesn't faze them at all. They look fine. And some people, if you look at their face, are so anxious and worried. This is exactly because what their background is. The person who has what we call pitta energy, the fiery energy, that person is angry. He will, if you can look at him, he might start making some gestures at the surrounding people. And the kapha people are a little more calm, a little more stable. Doesn't faze them that much. Says, okay, I'll go 5 minutes late, big deal. Like Santa Claus, happy-go-lucky fellow kind of stuff. And the Vata person are the anxious people. Vata is the principle of movement. So they'll be having that anxiety. Oh my God, I'm going to be late. I'll miss my appointment. What will happen to me? So that you can look at their face and you can see how they're acting and behaving even though they're stuck in the traffic. So if you know, bless you, if you know what your constitution is, what your dosha mix is, you can understand how you're likely to react in any given situation. So you can prepare yourself for that. You can also, by knowing using the same yardsticks, you can know what other people's constitution or doshas are like. So you can start having that relationship shift a little bit. If you know that your boss that you're working with is a pitta head, as we call it, or hot-headed, then you know that that person is expecting perfection. Give more than what you can, blah, 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 etc. You have to meet the deadline. So if you know that that's the type of person you're working with, you prepare yourself and give additional time to complete that goal. So you can improve the interpersonal relationship at work. The same thing at home with your family members and kids. If the spouse comes home in a very frustrated mode and the spouse is already a fiery person, then you know that the person is going to yell and shout and throw temper and throw things around. And you just have to tell that, honey, it's okay, I know you had a bad day today. Let's sit down and let me just offer you this little sweet first. Let's give something to eat to calm that person down a little bit. Most of the time, for example, back home in India, the tradition used to be that when somebody would come to your home, besides offering them the seat, the first thing you would do is offer them a glass of water. And then you'll ask them, what else can I get you, whether you would like something else to drink, cold, warm, whatever. But the idea is that when you're traveling, and Vata being the movement energy, your Vata has gone up. So that energy is a little out of balance. Whereas when you offer the cold water, the liquid, so liquid kind of tries to balances that Vata energy, the quick moving energy. So that's what they would do, sit down and give the water first. So there are ways that we can try to improve the relationship and thereby improve the quality of the life by improving the environment around us at work, at home, in our society. So, are we questioned about it so far? Perfect. You're such a wonderful audience. So, some of the common conditions in this day and age that we can think of, for example, stress, anxiety disorders, sleep disturbances. Very simple things one can do to relieve the stress, to relieve the sleeplessness. 5 or 10 minutes of sitting quietly before you go to bed and just being aware of your breath. Or drinking 1 cup of warm milk, if you're not lactose intolerant, with a little pinch of nutmeg and cardamom. Gives you a good night's rest. So there are other things we can do too, but of course we like to find out what's going on. Why are you having sleeplessness? But if you just want to fix something, we can do that too. The same thing about the weight management. And we all hear about the diet and the lifestyle are so important. The exercise is so important. But what I would say is that the weight management is not just a number. You can't take a number and say, this is what my weight should be. Even if you look at the insurance tables, as they call it, with age, weight relationship, etc. It's still, because the Ayurveda says each person has a different constitution, is different for a different person. The person with the kapha predominant energy is going to be a little heavier than the vata predominant energy. So you can't say that this is my ideal weight. But Ayurveda can help you to reach that ideal weight, whatever that ideal weight would be, by not only telling you about diet and the lifestyle, but what is the right type of diet for you, for everyone. And whenever I think about that, I think about how in recent months the dietary recommendations have shifted, gone from low carb, low fat, high protein, high carb. Now they say, oh, low carb, high fat. So they keep on shifting because the clarity is gradually coming into place. So Ayurveda says that it is important what you eat, based again on your energetic principles. but how you eat is much more important. And eating mindfully. And when we talk about mindfully, look at our lifestyle. Half the time we're in a hurry, so we don't even have time to sit down and have proper meal. So eating mindfully, the first and foremost is make meal a ritual. Have a fixed space where you're going to eat. Whether it is at workplace, that's okay. When you want to eat breakfast at work because you didn't have time at home. But at workplace, also have a little corner somewhere where you always sit there and eat. So making meal a ritual, satisfying all our senses. So when we look at the food, instead of just gulping it down, we look at the food, look at the color, enjoy the aroma of that food. And when we put that bolus in the mouth, try to feel the texture, the temperature. So as we satisfy all our senses, automatically our body feels, our mind feels that I have had enough nourishment, I don't have to overeat. And if we chew enough, it takes a little longer to finish that meal, so we are not in a hurry to finish the meal. That meal is digested better. Otherwise, that even though we take enough nutrition according to the recommendation, enough supplements and vitamin according to the recommendation, but that doesn't get properly digested and doesn't get properly absorbed, so it's not being properly utilized. So weight management, we can take care of that by using Ayurvedic approach. Of course, we use the herbs as well. We use the other modalities as well. The chronic conditions like diabetes, high blood pressure, high cholesterol, the Western medicine can go so far and just give you the pills and give you do your diet and lifestyle. Sometimes you can follow, sometimes you don't follow. Now you take the medicine and then you get the side effects, so now you get another medicine. It has a side effect, now you get another medicine. Actually, this was one of the reasons why from my Western medical world I switched over to Ayurveda studies and to start learning and practicing Ayurveda. Because one of my close family member, much younger to me, diagnosed with diabetes and high cholesterol. And one started getting the medicine and started developing the side effects, developed rheumatoid arthritis, started on the chemotherapeutic type drugs to fix that, had more problems with that. So that's when I said that, isn't there something else that can help rather than putting these people into a different mode? So anyway, so some of these chronic conditions, for example, helps with the weight management too. If you want to, and they're so simple remedies sometimes. In the morning, if you just take 1 cup of warm water, that's the first thing you put in your mouth, not tea nor coffee, just first 1 cup of warm water, that would allow your digestive process to start working better. And then if you want to cut down on the cholesterol issue, cut down onto fat in your body, etc., we put a little bit of like 1 tablespoonful of honey and a little squeeze of lemon or lime, like 1/4 slice of that, you squeeze that in there. Drink that first thing in the morning, and you would start noticing over a period of time the shift in your body itself. So the chronic condition, so sometimes, for example, for high cholesterol, we use herb called Gugulu, Omnifera mucol. That helps to reduce. Even using those kitchen spices like cinnamon. So in your cereal, you sprinkle more cinnamon on that and start noticing the difference. For diabetes, using the bitter herbs, bitter food would try to counteract the excessive sugar in your system. So there are measures that we can take. The immunological disorders like rheumatoid arthritis, allergies, there is effective remedy in Ayurvedic medicine. Actually, there was not too long ago, a controlled double-blind, and it is such a difficult to do double-blind randomized control study in the Ayurveda because Ayurveda doesn't believe in generalization. Ayurveda says everybody is individualized and you cannot have a double-blind controlled group for that. Right? But still, somebody did try to devise that to satisfy our Western mind. So there was in the Journal of Rheumatology a few years ago, an article was published about rheumatoid arthritis. It was the study was devised here. It was conducted in India. It was in collaboration with University in California, University in India, also UW School of Nursing was involved. Anyway, so that proved in that article that the Ayurvedic approach was as effective, if not more effective, than the Western approach. So there are more and more studies coming out like that. So the Western science is now trying to catch up with the Ayurvedic wisdom. And the age-related disorders like degenerative arthritis, and even though we call degenerative arthritis related to age, nowadays people start having arthritis in the knee and the hip and requiring the replacement surgery, etc., when they're still in their 40s. So if we incorporate the healthy aging, we can use the symptomatic treatment by using just a little bit of appropriate oil massage on your knees or in your hips. But you may not be able to reverse the process, but you may be able to slow down the process. So there are many things that Ayurveda can do to help us. The neurological disorders like Parkinson's disease. So again, we don't have any effective remedy in Western medicine for Parkinson's disease. It's a slowly progressive disease. But Ayurvedic methods of cleansing and detox, as we call it, one of the names is called Panchakarma. It's a very detailed treatment where you have to go through some preparatory phase, then you go through the treatment phase, then you go through the rejuvenative phase, etc. But here we do that preparation for about 5 to 7 days, actual treatment for about 5 days, and then post-treatment you go through almost a month about reestablishing your diet and the lifestyle, etc. But in India, they would do that over 4 weeks to 6 weeks' time. But even here, while I was going through my Ayurvedic studies at a place where I was at the Ayurvedic Institute, there was one professor of medicine in one of the university in Kansas or somewhere in Midwest. He had Parkinson's disease. He would come there every year, twice a year, to get the treatment done. And I was talking to him, and I said, so do you really notice the difference? He says, every time I come here, I notice that my rigidity, because that's one of the hallmark of the Parkinson's disease, the muscles, is much less. Then again, it progresses. And then I come here, it becomes less. So he said that I know that I'm slowing down the process of this disease. So we may not be able to necessarily cure everything, but we can still help to slow down the process. The digestive disorders like IBS, respiratory disorders like chronic asthma, musculoskeletal disorders like chronic fatigue, fibromyalgia. So all these things can be helped very nicely, very effectively using the Ayurvedic approach. So when we talk about bringing the balance into imbalanced people, first and foremost, it's an individualized approach. It consists of natural therapies. It addresses the imbalances at all levels: physical, psychological, intellectual, emotional, behavioral, spiritual, family, social, etc. And the goal is to heal disease, reestablish balance, prevent the disease occurring again, and continue to promote health and well-being. The diet is based on what I call Prakruti Vikruti Param, which is your natural constitution and the abnormal imbalanced state. The lifestyle, using yoga, stress management like meditation, breathing techniques, relaxation technique, music therapy, aromatherapy, this is all part of the Ayurvedic treatment. Using the natural supplements, using some botanical medicine and herbs, using the cleansing and detox procedures that I talked about, using some localized body therapy like massage, sweat therapy, or sauna, rejuvenation therapy using the appropriate daily and seasonal routine. We change our routine according to our season. And also counseling and health education. So this is how we try to bring the balance by using any and all, depending on what we need, of these practices. So when you come to an Ayurvedic practitioner, what would you expect? So Ayurvedic professional would take a history, a very detailed history. Not a 5-minute visit, not a 10-minute visit. It would be more like hour to hour and a half initial consultation. And the person would want to know, the practitioner would want to know all about you, right from your birth till today. They want to know your daily routine. They want to know what do you eat. They want to know how many times you go and have bowel movement, how many times you go and pee. So, I mean, they want to know intimate details, and there is nothing that is quote unquote off limits, so to say, because we want to know who you are. And then we try to, once we get to that point, once we've taken the detailed history, then we do the evaluation to find out what is your balanced state and what is your current imbalanced state. And how do we do that? By using the diagnosis of the pulse diagnosis, the tongue diagnosis, the face diagnosis, MARMA. MARMA is very much like acupressure points. So MARMA evaluation. So we try to figure out what is your state of balance, the natural state of balance, what's your natural constitution, and what's currently going on. Once we come to that, then we design the appropriate management protocol that can include and may include dietary and lifestyle suggestions, herbal supplements, physical therapies like massage, sweat therapy, etc., cleansing therapies, yoga, meditation, pranayama, and you'll be given the follow-up instruction. So what makes Ayurveda so special? The first and foremost, that it respects the uniqueness of each individual. It considers all aspects of individual, not just the body. It emphasizes prevention, and it is a holistic medical science offering natural ways of treating diseases and promoting health. So it can be used as a complementary medicine. When people come to me and ask me, should I do this naturopathic treatment that I've been offered with supplements, or I've been to this Western medical doctor and they're giving me this type of medicine, should I use that? And I said, work with your doctor. Keep your doctor informed. Whatever I'm going to tell you to do, it will shift things around. So that if you are, say for example, taking medicine for your diabetes, monitor your blood sugar very carefully, because your blood sugar will start shifting and your doctor will have to adjust the dose accordingly. So I said, do not stop taking whatever treatment you're taking because you've started Ayurvedic approach, because I want you to use the Ayurveda as a complementary thing right now. You might find as time goes by that the need for the other medicine and the supplements become less and less, and then you can get off that completely, and that's okay. But don't just give up whatever you're doing. It can be used as an integrative medicine, so that's another approach too, that we can incorporate. So if I see somebody and I say, okay, I know this is how I will help you, but you can also go and see so-and-so because you need additional help. Your condition is such that needs some acute relief first before we start doing other stuff. Because after all, the Ayurveda is a slow process. It's not a quick fix. It starts shifting things slowly and gradually. So we use that as an integrative approach. Yes, that's the end of my talk. So any questions, I'm open now. We've got lots of time. As I said, I'll give a lot of time for you guys to interact with me.